drive down the cost.
Governor, is there anything, you know, some people say there's been a lot of 10th Amendment bills that have come out, a lot of bashing of the federal government. On the other hand, you know, the state is doing an all-out recruitment to get federal dollars here with the F-35s and other programs like that. Is there a disconnect between bashing the feds on one hand and then sort of, you know, begging for their business on the other hand?
Brian, I'm going to ask some of these folks behind me to help answer that question. But if we don't know the difference between the proper role of government in the defense of this country with the F-35 and health care and how that somehow fits into the federal priorities, we've got a big problem. One is you're talking about a proper role of government that our federal government was designed for. The original 13 colonies got together for their mutual defense. And that included at the time maybe a few muskets and some 4-inch cannons and stuff like that. But it's evolved into the F-35. But obviously, I grew up in a time, Brian, when there wasn't any Medicaid. There wasn't any Medicare. You turned to your family. Both my grandmothers died in our living room, in my folks' living room, because they weren't wards of the state. They were for us to take care of. They were family. And the further we get away from that, and I'm not suggesting that we could go back to that, but what I'm saying is that there was a time when we didn't have all of this because we had family and we relied on family. Jim, why don't you?
Yes, sir. Thank you very much. Brian, this isn't a nullification act at all. All this does is it puts it in code. It's now the law of the land, and it will give Idaho standing in federal court. That's the whole argument. The issue is that how can somebody mandate us, because we're breathing, to buy health insurance? And it's one size fits all, which isn't going to work. And Idaho is now saying in code, not by proclamation, but in code, we're not going to stand for that.
Anybody else want to add to that? Lynn?
Brian, you also have to remember that the federal government has our money. And so we need to ask for that money back. When they stop taking our money, then we can use it here.
Anybody else? No?
Well, I've heard that argument several times, Brian, and I think it misses the point. The F-35 program is a program that is a proper role of government. It's a program that the federal government is going to put somewhere. And the state of Idaho is the best place to have the F-35 facility in the whole United States. The other question is medical health care the proper role of government? It isn't. The federal government should not be involved in our medical decisions. The federal government should not be involved in the things that Congress is doing right now. And for that reason, we as a state have said that we are sovereign, that we will decide for ourselves whether we want legislation dealing with health care. That we're going to take care of this problem in the state and not through the federal government.
You know, Brian, I think that I think you asked a viable question, but I think we also have to recognize, let's look at the federal government's track record. Do you want them selecting your doctor for some illness that you have? Is that something that really excites you when you think about Social Security and all the other programs the government administers that are headed downhill, that aren't effective, that aren't successful, and you want to put them in charge of your medical care? This isn't where the federal government belongs.
Anybody else? Any other questions?
I just have to ask, because we've been asked by viewers and constituents, just wanting to know, is this really a good use of time and resources when we're also dealing at the state level with massive education budget issues? And people just want to know, is this really necessary?
Well, I put a real high priority on the sovereignty of the state of Idaho. I put a high priority on the business the legislature has. Obviously, we're still working on budgets. And if it had been, sure, I'd like to have this done the first week. That would have sent a real strong signal to the federal government that this was a high priority for us in the state. These things have a tendency that they need to work their way legitimately and legally through the rules that have been set down over decades and decades that we're following in Idaho, that unfortunately the Congress right now under the Democrat rule under Pelosi and Reed are not following. I've served in Congress for 6 years, and I voted on deemed-passed bills several times, but they were only amendments. You still have to vote on the final bill. And I think if they go forward with that, the constitutional challenge by so many areas, it is just a question of time. So the answer to your question, yes, it is a proper use of our time.
Governor, today Congress passed the jobs bill, as we talked about a lot, but also included in there was an extension of the FMAP increase that was passed through the stimulus package. So I know in your budget you set aside that $71 million for the potential cliff that was talked about.
Mm-hmm.
So would you agree that it's good that that has happened? So is there a disconnect there as to where we're saying, this federal bashing, but also glad that the federal government is still going to pay that extra money?
You guys are too used to editorial policy. Probably you're wrong. Bashing is hardly what we're doing here. We are informing them. If we were bashing, there would probably something be more involved in a few pieces of paper and a pen. Okay. What we're doing is informing them of our intent today and our state policy tomorrow. And as soon as that's signed into law, it will become state policy. So, and another thing, please help me there. How can we forget the state of Idaho taxpayers send $6 billion a year to Washington, D.C. And now we're getting it back. But remember, when we do get it back, it was the FMAP and it's the Medicaid. All of those come with a whole series of rules that without those rules and regulations and restrictions and stipulations and reportings and all of the other problems that come with those, all of the other mandates that come with those, that we could probably provide a whole lot more benefit to a whole lot more people in healthcare need. And if we didn't have all of those and if we could rely on our own common sense right here in Idaho and be treated as an individual rather than as just an amorphous mass of people that our only existence in this world is to make sure that we obey congressional dictates. I guess you might think you touched the nerve. Any other question? Yes, sir.
Governor, how is federal requirements to buy health insurance different from requirements to buy car insurance?
It's not a federal requirement. Show me where in federal law that we're required to buy car insurance.
The states require people to buy car insurance.
You just answered your own question. There's the difference.
There's another difference too.
Go ahead.
The other difference is that in car insurance, you have a privilege to drive a car. This health insurance tax will be because you are a human being and you breathe. There's no connection to any privilege.
That's it. Thank you so much for being here. Oh, I guess I'll sign it. Hey, it's St. Patrick's Day. Happy St. Patrick's Day, everybody. How many do we need?
One more.
One more for you.
Yes, sir.
And this was signed at 3:17. Everybody else get one? That wants one? Obama taught me how to do this. Looks like penmanship class. Do you know what penmanship class is? Do you remember penmanship class? Do they still have that?
Yes, sir. And I can do this one.
Okay, thank you so much for your time. Appreciate it.